Whew. It's hot. Happy Wednesday, though. Can you all hear me? Hello. Welcome. Happy Wednesday. Great. Happy Women's Wednesdays. Yes, it is hot. But I hope you all are staying cool. It's the middle of the week. There's only 2 more days till the weekend. So I hope you all are hanging in there. For those of y'all who do not know, my name is Soul. I'm one of the social media influencers for community health, as well as an art educator for Whitman-Walker's Cultural Center, The Corner. So make sure you follow The Corner DC to keep up with that work as well. And my pronouns are she, they. Today we're going to be talking about how the COVID-19 pandemic is affecting women. And I just want to give us a couple more seconds before I start for more people to join. Hello. Welcome. Thank y'all for joining. It is going to be a long weekend. People should be safe. And we're going to talk about being safe later. So, as you all know, for the past few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focuses on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. Today we're going to talk about the COVID-19 pandemic and its effect on women. Of course, COVID-19 has affected everyone in some way, but women have had a particularly difficult time during the pandemic. This is also true on a local, national, and international level. Many of the negative impacts are ongoing and have the potential to last for years. And we'll talk about a few of them right now. So please comment below if you have any questions, if you want to share your thoughts, opinions, and or personal experiences. I'm excited to be here and share space with y'all. So let me start by introducing a little bit of the history and putting the gender-specific hardships brought on by COVID-19 in a historical context. For the past century, women have made incredible gains in achieving greater freedom and equality. 100 years ago, in the 1920s, women had just achieved the right to vote. Though when I say women, I really mean white women. Hey, Chi. And only 1 in 5 women participated in the workforce. By the 1950s, over half of women were working, though they were still expected to fill domestic roles as homemakers and caretakers. Fast forward to the 1980s, after America had experienced the second wave of feminism. Nearly 3/4 of women were not just in the workforce, but breaking barriers left and right, and are continuing to do so. Fast forward one more time to today, where we have a woman as Vice President of the United States, and women are doing more than ever before. In a broad context, this looks amazing. This looks like amazing progress, but the truth is that women still face a number of challenges in today's economy and society. Women are still disproportionately represented in low-wage jobs. In America, they only make about 82 cents on the average for every dollar a man makes. Women still serve as the primary caretakers of children, especially single mothers, and our child care and school systems do not meet the needs of many working mothers. Additionally, women do not face these challenges equally. Women of color experience the largest wage gap of all, and they often have the least support in raising families. This is true internationally as well, and in many countries, women have even lower economic and social mobility because they cannot access primary education, basic health care, or other necessary service for advancement. My point is, a big reason why COVID-19 is hard on women is because the international economy and many societies are hard on women, and COVID just takes existing problems and ratchets them up. Let me explain what I mean. A stunning 39% of people living in low-income households reported a job loss in March of 2020 when the pandemic first hit. While there are signs of the economy that is slowly improving, many people remain out of work. And because women are concentrated in low-wage and face-to-face jobs, these layoffs hit women especially hard. While many higher-wage jobs could transition from an in-person to remote work environment, that wasn't the case for the majority of low-wage jobs that relied on interaction between customers and workers, like retail sales and hospitality, two of the most common occupations among low-wage women. And I've worked in retail, and trust me, it's not fun. It's not fun. It's not fun. I'll tell you all more about my experience working in retail a little bit after this. The unemployment rate for women jumped by more than 12 percentage points between February and April of 2020, while the rate for men increased by less than 10 percentage points. The losses for women without college degrees is even more staggering, and between March and the early April of 2020, their employment rate dropped 15 percentage points compared to a drop of 11 percentage points among non-college educated men. Those low-wage women who did not suffer job losses were primarily in the frontline occupations, such as healthcare support and grocery workers. Those women continued working, but they often didn't have access to appropriate personal protective equipment, putting their health and the health of their loved ones at risk. COVID-19 has also increased the pressure on working mothers, both low-wage and otherwise. In a survey from May and June of 2020, 1 out of 4 women who became unemployed during the pandemic reported the job loss was due to a lack of child care, twice the rate of men surveyed. A more recent survey shows that the losses have not slowed down. Between February and August, mothers of children 12 years old or younger lost 2 million jobs compared to 900,000 jobs lost among fathers. In September, right as school started, 4 times as many women as men dropped out of the labor force, roughly 900,000 women compared with 200,000 men. The losses in childcare and school supervision hours as a result of the pandemic could lead to a significant decline in women's total wages. This report estimates that if conditions for families do not improve and if the levels of maternal labor force participation and work hours experienced during the April 2020 first wave peak of infections and COVID-19 lockdowns persist long-term, lost wages would amount to nearly $100 billion per year. This is a crushing loss to families and community that are still reeling from the pandemic-induced economic collapse. And without a significant public response, these consequences will have additional ripple effects that will continue to hurt communities and stifle the economic recovery. To combat these really terrible consequences of the pandemic, we need robust responses. Solutions to improve the conditions of working women have to address both aspects driving the disproportionate harm they have borne as a result of COVID-19's economic impacts. An over-reliance on inadequate childcare system and their concentration in low-wage jobs. While the role of women in our economy has shifted over the last 100 years, our systems have not. similarly evolved to support them. Because these conditions have been in place for so long, the solutions can't focus on short-term COVID-19 recovery alone. They have to also make long-lasting changes that aim to close the wage gap, improve working conditions and family leave options, and better align the child care and school systems to the needs of working parents so that mothers who want to work can do so. Policy needs to reflect that women have fundamental roles in both the workplace and in families, and to support women in those roles. What do you all think about that? Hello, welcome. Any questions, comments, thoughts, experiences? I know my experience working, I can't imagine working in retail now, or working in hospitality in general, or face-to-face, really just being a frontline or an essential worker right now. The people that are doing that and serving community and people face-to-face, I really commend y'all, because I know working in retail, I don't know if I could work in retail now. My personality and who I am today are I don't think I'd be able to do it. And so I hope you all are being respectful when you all are going and shopping, and, going out to eat. I hope y'all are continuing to stay safe. I do want to remind you all that knowing your status is the best way to stop the spread of HIV. Whitman-Walker Health can help you figure out your HIV status through our free HIV STI testing services by appointment at our Liz location in Northwest DC and our MRC location in Southeast DC. To make an appointment, you can call 202-797-4439. You can also access our PrEP services by calling 202-939-7690. And our PrEP services by calling 202-797-4439. If you're newly diagnosed with HIV, call 202-797-4439. I do have these numbers in the comments as well, so you can grab them from there if you didn't catch them. And you can also stop the COVID pandemic by making sure that you are getting informed on the vaccine and your options, staying away from people for at least 6 feet and wearing a mask when appropriate, avoiding places with large crowds, encouraging work from home if possible, speaking with loved ones on the phone or over FaceTime instead of in person. Stay up to date on local, state, and national guidelines for testing, quarantine, and general safety. Washing hands for at least 20 seconds at a time, and stay home if you all don't feel well. Follow us on Twitter, Facebook, and IG at Whitman-Walker and at Road Talk DC and at The Corner DC. You all can follow me at SolLikeSoul. That's SolLikeSoul. You can also follow something that I'm hoping to be able to work on some more this summer, my Femmes Who Collective, at Femmes Who, at FEMMESWHO. Until next time, stay safe.